Welcome to Dr. Dean's special bonus video titled COVID-19 April 2020, a Revised Strategy. In January of this year, after the virus was confirmed here, we imposed travel bans, started barrier protection such as masks, social distancing, and lockdowns based on fear of the unknown and mathematical models projecting millions of deaths. That was then. This is now. With more than 3 months hard data about COVID-19, the unknown is now known. So what should we do? Here is what we know. COVID-19 is a highly contagious respiratory virus like SARS, but this one primarily attacks debilitated patients, the elderly, those with impaired immune systems, heart or kidney failure, and especially those with any form of chronic lung disease, including longtime smokers. Though it is transmitted directly from person to person, the virus can also live on surfaces for a while. Numerous Americans have been infected, many more than reported as confirmed cases, since we are only testing people who are symptomatic. The number of previously infected and now immune Americans could be in the millions. Since 2020 January, more than 20,000 Americans have died and more than 85,000 have been hospitalized, presumably due to COVID-19. However, roughly 3/4 of the deaths attributed to the virus did not die because of COVID-19. They succumbed to their pre-existing conditions. There is a huge difference between dying because of the virus or dying because of a pre-existing condition like heart failure while testing positive for the virus. Infection does not equal illness and certainly does not equal death. To give you a sense of perspective, compare the current COVID-19 pandemic to the last two flu pandemics. In 2017-2018, 48.8 million Americans contracted the flu. 959,000, just shy of a million, required hospitalization, and we lost 79,400 of our people. In 2018-2019, 42.9 million people got the flu, 647,000 were hospitalized, and 61,200 died. So far with COVID-19, 500,000 Americans are confirmed to have the virus. A little over 85,000 have been hospitalized, and over 20,000 have died, compared to the 69,000 or 79,000 the last 2 years from flu. You could rename COVID-19 as, quote, flu 2020, and a mild version at that. Projections in January of 2020 from mathematical modeling warned that as many as 2.2 million Americans might die. We based our current strategies on that highly flawed estimate when in fact we've lost 20,000 people, not 2 million. In Washington state, they built a 300-bed field hospital inside the Seattle Convention Center in preparation for a huge overflow of COVID patients. The overflow never happened, and so now they are dismantling the hospital. At present, by keeping us apart, social distancing is separating the herd. It is also preventing herd immunity. Most people can't go to work. Travel is restricted, and mass gatherings from sports and concerts to churches are closed down. We are dying economically, and our civil liberties have been taken away in the name of flattening the curve of infection. And always remember that infection does not equal illness. Flattening the curve won't stop the virus. It only slows its spread. In the absence of a vaccine, the only way to kill this epidemic is by natural herd immunity. People get infected and they develop their own antibodies, and that's how they self-immunize. Instead of basing our antivirus strategy on flawed models, we can now use facts to design a strategy that will accomplish the following. Stop, not merely slow the virus. Create an immune American populace. Begin to restore our vibrant economy and regain our civil liberties. Our best strategy for COVID-19 in April 2020 starts by reversing the lockdown, allowing the healthy majority to return to work and to return to play. By stopping social distancing, we will develop herd immunity with a low risk of an illness or death. I know that after all the media hype, throwing away your face mask and shaking hands again may seem scary. Let me ask you this. Were you afraid of dying last year from the flu? Did you lock yourself in your house for fear of contagion? Today, if you don't already have a life-threatening pre-existing condition, you have the same risk of dying from COVID-19 as you did last year from the flu, maybe even a little less. Second strategic move is to protect the small number of Americans at high risk by strict quarantine of the debilitated, the elderly, that's me, and others with pre-existing conditions. Because we are only testing symptomatic persons, we don't know how many Americans were infected, never had symptoms, and now are immune. In other words, we don't know how much herd immunity we already have. It could be millions. We need mass testing for COVID-19, not just for those with symptoms, but everyone. Furthermore, we need to test both for the genome, which shows current infection, and for antibodies, which demonstrates past infection. That is the only way to know how far the virus has spread and how much herd immunity we have. Finally, we should continue aggressively testing both vaccines that prevent infection as well as drugs that could cure those who are ill. If you haven't already viewed my previous COVID-19 video titled Injecting Reality into COVID-19 Mass Hysteria, please do check it out. You can view it by going to the website We Can Fix Healthcare at deanwaldman.com. That's Dean with an E. My mother did that to me 76 years ago. Just click on the blinking icon at the top right and subscribe. It's free. There is no charge for any of the bonus materials. While you are still in lockdown and looking for something fun to read as well as useful, try Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine. After this COVID nonsense is over, we will still be stuck with a healthcare system that doesn't work, and this book will show you how to get affordable as well as accessible healthcare. Also, be sure to subscribe to my YouTube channel to view the latest videos. Just click on my image on the right of your screen. Thank you for watching, and please encourage others to watch as well.